Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling quite weak and have had persistent night sweats for the past couple of weeks. It's starting to concern me because I also noticed I've lost some weight recently without trying.
I understand your concern. Can you give me a bit more detail about your symptoms? Have you noticed any other changes?
I've been really fatigued lately. It's different from just being tired. Even when I sleep for a full night, I wake up feeling exhausted. I've lost almost 10 pounds in the past month.
I'm sorry to hear that. Any fever or other symptoms like chills, cough, or shortness of breath?
No fever or cough, but I've had some mild joint pain. It's not very intense, but noticeable.
Do you remember when all this started?
The weakness and fatigue started around 3 weeks ago. The night sweats have been happening for about 2 weeks. My appetite has also decreased, and I only realized the weight loss last week when I checked my weight.
Have you experienced any swollen lymph nodes or lumps anywhere in your body?
I've noticed some swollen nodes in my neck that weren't there before.
Can you describe what the swelling feels like? Are they painful?
They're firm but not painful. I've never had anything like this before.
How about your family history? Any history of cancer or autoimmune conditions?
My father had lymphoma about 10 years ago, and my grandmother had rheumatoid arthritis.
Do you take any regular medications or have you taken any recently?
I take a multivitamin daily, but no regular medications. I did finish a course of antibiotics a month ago for a sinus infection.
Did the symptoms begin before or after you finished the antibiotics?
The fatigue started just after I finished the antibiotics.
Have you had any recent illnesses or infections aside from the sinus infection?
No other illnesses. The sinus infection was the only recent issue.
I'm going to ask about your lifestyle habits to get a better understanding. Do you smoke or drink alcohol?
I occasionally drink a glass of wine with dinner, but don't smoke.
What about your diet and exercise habits?
I eat a balanced diet and exercise 3 times a week, mostly jogging and some weight training.
Do you recall any recent travel or potential exposure to infectious diseases?
No recent travel, but I do work in an office with a lot of people.
I'm going to recommend some blood tests and a few imaging studies, including a chest X-ray and ultrasound of your abdomen. I'd also like to schedule a biopsy of those lymph nodes if your results indicate a need.
That sounds good. How long do you think this will take?
We should have some preliminary results within a week, but the biopsy might take a bit longer. I'll keep you informed as soon as I have the results.
Thank you, doctor. I appreciate your help.
Of course, I'll get the test scheduled and ensure you're updated every step of the way. In the meantime, take care of yourself and don't hesitate to reach out if your symptoms worsen or you have any concerns.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. My name is Dr. Williams, and I'll be your doctor today. Could you please confirm your name and date of birth for me?
Good morning, Dr. Williams. I'm Michael Brown, born on June 14, 1972.
Thank you, Michael. What brings you into the clinic today?
I've been experiencing some chest pain over the past few weeks. It's more of a dull ache, and it tends to come and go.
I see. Is there anything in particular that triggers the pain, or does it happen randomly?
It seems to happen when I'm stressed or after physical activity, like climbing stairs.
Have you noticed any other symptoms like shortness of breath, dizziness, or nausea?
Yes, I do get a bit short of breath, especially when the pain is at its worst.
Are you currently taking any medications or have any existing medical conditions?
I take a daily low-dose aspirin because of my family history of heart disease. My father had a heart attack in his late 50s.
All right, let's start by taking your vitals to get a baseline before we proceed with further tests. Is that okay?
Yes, of course.
First, let's check your blood pressure. Please relax your arm on the table.
Sure, here you go.
Thank you. Your blood pressure is 140/85, which is on the higher side. Now I'll check your pulse.
Okay.
Your pulse is 85 beats per minute. Now let's measure your oxygen saturation level. Please place this sensor on your finger.
All right.
Your oxygen saturation is 97%, which is within the normal range. Given your symptoms and family history, I recommend an electrocardiogram (ECG) to assess your heart's electrical activity. Let's get you set up for that.
Okay, I understand.
Please remove your shirt, and I'll place the electrodes on your chest.
Done.
All right, the test will take a few minutes. Just relax and breathe normally.
The ECG shows some irregularities, which could indicate an underlying cardiac issue. I recommend further evaluation with a stress test and possibly an echocardiogram.
That sounds serious.
It could be, but it's too early to tell. These tests will provide more information about your heart's function under stress and help us determine the best course of action.
I see. How soon should I get these tests done?
We should schedule them as soon as possible, ideally within the next few days. In the meantime, try to avoid strenuous activities and manage your stress levels.
Understood. Is there anything else I should be aware of?
Yes, you should watch for worsening symptoms like increased chest pain, shortness of breath, or dizziness. If any of these occur, seek medical attention immediately.
Thank you, Dr. Williams. I'll follow your advice.
You're welcome. My assistant will help you schedule the tests before you leave. Take care, and we'll have more information once the tests are done.
Thank you. Goodbye.
Goodbye, Michael.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
The new patient, Jenny, has been struggling with asthma. Her mother says the wheezing episodes have become more frequent.
How old is she?
She's 8 years old. Her asthma was initially controlled with just salbutamol, but now it seems like she needs a more comprehensive treatment plan.
In that case, we should consider moving her to a maintenance therapy, maybe inhaled corticosteroids?
Yes, that's my thought as well. A low-dose inhaled corticosteroid could help prevent these exacerbations. We should also ensure her mother understands how to properly use the inhaler and spacer.
Definitely. And education on environmental triggers would be crucial too. Allergens could be a factor if they have pets at home.
Good point. We should also consider spirometry to assess her lung function more precisely.
Agreed. I'll schedule an appointment with the respiratory specialist and provide her mother with educational materials on asthma management.
Great. Let's also discuss an asthma action plan to help the family recognize worsening symptoms and when to seek medical attention.
Now look at question 26.
How's Mr. Lee doing after his knee surgery?
He seems to be in a lot of pain despite the medications.
What is he currently on?
He's on a regimen of oral NSAIDs and acetaminophen, but I wonder if he could benefit from a stronger analgesic.
That might be necessary in the short term, perhaps a low dose of an opioid for breakthrough pain, but we should be cautious about dependency.
I agree. We could also consider non-pharmacological methods like ice therapy or physical therapy to complement the medication.
Yes, pain control after surgery is crucial for mobility and recovery. Let's consult with the pain management team to see what other options might be available.
Good idea. I'll coordinate with them and keep you updated on his progress.
Thank you. And let's ensure Mr. Lee understands his pain management plan and any potential side effects of the medications.
Absolutely. Patient education is key for effective pain management.
Now look at question 27.
Good morning, Mrs. Clark.
I'm here to discuss your son's vaccination schedule.
Yes, I'm a bit worried about his upcoming shots. He's had some reactions in the past, so I'm concerned.
I understand your concern. Minor reactions like fever or soreness at the injection site are quite common, but serious reactions are very rare.
Can you tell me more about the vaccines he's due for?
Certainly, he's scheduled for the DTaP, MMR, and varicella vaccines. These protect against diphtheria, tetanus, pertussis, measles, mumps, rubella, and chickenpox.
Are these all really necessary?
Yes, they are crucial in preventing serious diseases. While these illnesses may seem uncommon, vaccination has significantly reduced their prevalence. Without vaccines, they could make a comeback.
I see. Are there any specific precautions I should take after the vaccination?
After the shots, it's best to monitor him for any unusual symptoms. You can give him acetaminophen for fever or soreness. Also, keep him hydrated and comfortable.
Thank you. I'll keep an eye on him after the shots.
Now look at question 28.
Mr. Thomas, I see you're scheduled for a knee replacement next week. Are you prepared for the surgery?
I've been doing my best to get ready, but I'm still a bit nervous.
That's understandable. Joint replacement surgery can be daunting, but it's a step towards improving your quality of life. Do you have any specific concerns?
I'm mainly worried about the recovery process and how long it will take.
Recovery varies, but most people start to walk within a day or two after surgery, with physical therapy to guide you through the process.
How long before I can resume my normal activities?
That depends on the individual, but generally, people can return to routine activities within 4 to 6 weeks. However, complete recovery could take a few months.
And what should I be doing before the surgery to ensure the best outcome?
It's important to stay active within your pain limits, maintain a healthy diet, and avoid smoking. You'll also receive detailed instructions from the surgical team.
Okay, I'll follow the instructions carefully. Thanks for the guidance.
You're welcome. We're here to support you throughout the process.
Now look at question 29.
Good afternoon, Mrs. Thompson. I'm following up on your concerns about your daughter's nutrition.
Thank you for reaching out, Doctor. I'm worried she's not getting enough nutrients since she's a picky eater.
It's not uncommon for children her age to be selective with their food. What types of foods does she typically refuse?
She's not keen on vegetables and refuses to eat most fruits. I worry she isn't getting enough vitamins.
It's important to encourage a variety of foods. Sometimes offering different textures and flavors can help. Have you tried incorporating vegetables into dishes she already likes?
I've tried adding them to pasta and smoothies, but she notices and refuses to eat them.
It might be helpful to involve her in meal preparation. Kids often enjoy eating foods they help prepare. Another approach is offering smaller portions frequently rather than large meals.
That's a good idea. I can try involving her more in the kitchen and experiment with smaller servings.
Great. Also, a multivitamin could be beneficial until she becomes more comfortable with a wider variety of foods.
I'll consider that. Thank you for your advice.
Now look at question 30.
I'm glad we could meet to discuss the recent changes in our department.
Absolutely. Communication has been a challenge lately, especially with the new electronic health record system.
I've noticed the same. It's difficult to coordinate effectively when everyone is struggling with the learning curve.
Exactly. I think improved communication is key to addressing this. Perhaps a quick daily meeting could help keep everyone informed.
A great suggestion. A brief meeting at the beginning of each shift could ensure that everyone is on the same page.
And if we could incorporate a way to report technical issues quickly, it might help us address problems before they escalate.
Definitely. A centralized reporting system could streamline how issues are flagged and resolved.
It would also be useful to have more training sessions so that staff can feel more confident using the new system.
Agreed. I'll look into arranging some additional training sessions, and will follow up with you on scheduling those.
Thanks. With better communication and training, I'm sure we'll see improvement.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning. My name is Dr. Sarah Thompson, and today I'd like to share insights from a comprehensive study we recently conducted, focusing on the early detection and management of chronic obstructive pulmonary disease, COPD. This project aimed to investigate the prevalence of undiagnosed COPD in high-risk populations and to evaluate the effectiveness of various screening methods. Allow me to walk you through our approach, findings, and the insights we gathered. COPD is a progressive lung disease characterized by long-term breathing problems and poor airflow, primarily due to emphysema and chronic bronchitis. It's often associated with long-term smoking, but environmental factors and genetic predispositions also play a significant role. Our study specifically targeted underserved communities where smoking rates and exposure to air pollutants are relatively high, leading to an increased risk of COPD. We partnered with urban and rural community health centers across 8 sites to establish mobile clinics for COPD screening and education. Each site had a multidisciplinary team, including a pulmonologist, a nurse specializing in respiratory care, and a respiratory therapist. Together, they conducted screenings, collected data, and offered personalized consultations. During the project, we screened a total of 550 individuals and identified 95 new cases of undiagnosed COPD, bringing those individuals into immediate care. Here's what stood out in our findings. We identified a substantial gap in understanding the risks associated with COPD, even among those with a long history of smoking. Many participants were unaware that symptoms like persistent cough and breathlessness could indicate early-stage COPD. Additionally, social determinants, like limited access to health care and low health literacy, played a significant role in delaying diagnosis and treatment. We found that partnerships with community organizations were crucial for reaching high-risk populations. By leveraging established trust networks, we were able to conduct effective outreach and education, increasing the likelihood of people participating in our screenings and following through with treatment. Early diagnosis of COPD can significantly improve management outcomes. Our project showed that spirometry, combined with a detailed medical history, was an effective screening tool. Early intervention allowed us to prevent further lung damage and provided an opportunity for smoking cessation and other lifestyle interventions. In many cases, participants were unaware of the link between smoking and COPD or had misconceptions about the disease. We learned that effective education needs to be culturally tailored and provided in a way that resonates with the community. This included using simple language and visuals and providing information in multiple languages. This study emphasized the importance of proactive screening for COPD in high-risk populations and highlighted the need for effective community engagement and education. By identifying undiagnosed cases early, we can improve outcomes and quality of life for those affected. Moreover, this approach can serve as a model for other chronic diseases, demonstrating the value of bringing specialized care to underserved communities. Thank you for your attention, and I'm happy to answer any questions.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hypertension, commonly referred to as high blood pressure, is a prevalent health issue affecting millions globally. Despite being well known, it remains underappreciated in terms of its long-term consequences, which can be life-threatening. Like how lice infestations often evoke stigma, hypertension is frequently underplayed due to its subtlety and lack of immediate symptoms. A brief look at the basics of hypertension is warranted. It is defined as consistently elevated blood pressure in the arteries. Primary hypertension is more common and doesn't have a specific cause, whereas secondary hypertension is usually the result of an underlying condition like kidney disease or hormonal disorders. Hypertension's silent nature is why it is often referred to as the silent killer. Many people don't realize they have it until it has caused significant damage, like heart disease or kidney failure. Symptoms, when present, can include headaches, shortness of breath, and nosebleeds, but these often only occur when blood pressure levels have reached dangerous levels. Detection and monitoring are essential in managing hypertension. The gold standard is ambulatory blood pressure monitoring, where blood pressure is recorded over 24 hours to capture a comprehensive picture of an individual's levels throughout the day. However, regular monitoring at home with a digital monitor is also effective and more accessible for the general population. The etiology of hypertension is multifactorial, involving genetic, environmental, and lifestyle factors. A sedentary lifestyle, poor diet, and excessive alcohol consumption are among the chief contributors. Stress and sleep apnea also play significant roles. Understanding these risk factors is crucial for developing effective prevention and treatment strategies. Treatment for hypertension is multifaceted, often beginning with lifestyle modifications such as reducing salt intake, increasing physical activity, and managing stress. In many cases, medications are prescribed to manage blood pressure. These include ACE inhibitors, beta blockers, and diuretics, each working through different mechanisms to lower blood pressure. One of the challenges in treating hypertension is medication adherence. Side effects can deter patients from taking their prescribed medication consistently, while others simply forget or misunderstand the importance of regular dosing. It's estimated that nearly half of hypertensive patients are not managing their condition effectively, either due to non-adherence or other reasons. In our research, we are currently investigating the role of digital health tools in managing hypertension. These include smartphone apps that remind patients to take their medications and monitor their blood pressure. The preliminary data suggests that these tools significantly improve adherence, especially among younger patients who are more tech-savvy. Another avenue of research focuses on the potential of gene therapy in treating hypertension. Scientists have identified specific genes linked to high blood pressure, raising the possibility of targeted gene therapies that can modify these genes to reduce blood pressure. However, this is still in its infancy and far from being applied in a clinical setting. Looking ahead, it's clear that more needs to be done to tackle hypertension on a societal level. Public health campaigns that raise awareness about the risks and encourage lifestyle changes could significantly reduce the prevalence of this condition. Additionally, more research into the genetic basis of hypertension could open new doors for personalized medicine. Ultimately, hypertension may not have the immediate stigma of lice infestations, but it remains a significant health concern with potentially devastating consequences. Addressing it requires a multifaceted approach that involves lifestyle changes, medication adherence, and emerging technological solutions. Further research is essential to enhance our understanding and develop more effective interventions for this silent killer.